SARS-CoV-2, coronavirus, COVID-19, corona. All names for that one stinking thing that really ruined people's lives and tragically altered many others. So yeah, here we're going to have 24 commonly asked questions with answers for about SARS-CoV-2. So I'll show you the outline. This is the outline if you want to pause the video and take a look at it. And yeah, let's start. So what is SARS-CoV-2? Well, it's a coronavirus, which is a family of viruses that have a distinctive crown-shaped appearance on electron microscopy. And it causes SARS, which is severe acute respiratory distress. And it has not been known to infect humans previously. It happened in 2019. And I should note that not all infections lead to disease. So you have SARS-CoV-2, which is the virus which causes the infection, but it does not always lead to disease, which is COVID-19. That's the disease, COVID-19. So take note of that. There are asymptomatic infections where someone can be infected with SARS-CoV-2, show no symptoms, and they would not then have COVID-19 because COVID-19 is the disease. So how does SARS-CoV-2 spread? Well, it spreads mainly through droplets, not so much from aerosols, though some studies purport this is happening. So what are droplets and aerosols? Droplets are basically the bigger drops of breath that are exhaled, while aerosols are the smaller ones that can linger on in the air, so they're called airborne. Though this hasn't really been conclusively proven, and probably not, mostly through droplets. So that's what you need to watch out for. And we'll talk about hygiene theater a bit later. So what's the incubation period of SARS-CoV-2? Well, on average, it's about 4 to 5 days with a range of 1 to 14 days. So you have to count 14 days to make sure you're safe. But usually, between 4 to 5 days, you don't get it, you don't feel any symptoms. You test negative as well, because we speak about asymptomatic transmission as well. You likely don't have it. So you don't... Waiting 14 days almost assures you 100% you don't have it, and I say almost because there have been reports of longer incubation periods, and it is, well, possible, but just 4 to 5 days and you should be safe. So what are the symptoms of COVID-19, which is the disease produced by SARS-CoV-2 infection? The most common are said to be cough, fever, and shortness of breath, though shortness of breath occurs more so in more severe disease. Of course, tiredness, muscle aches, chills, sore throat, these also occur in the flu. Runny nose a bit, not so common. Headache, yep. Chest pain a bit as well. Loss of taste or smell, it's becoming more common to see. Some studies say very infrequent this symptom. Some studies say this is a very frequent symptom. It might be the distinguishing characteristic between COVID-19 and the flu. So yeah, we'll have to see more studies about that. And digestive symptoms have been known to occur in about 1/3, sometimes it is said. These are more atypical symptoms of COVID-19, but of course they do occur, the digestive symptoms. So yeah, these are mostly the symptoms of COVID-19. Okay, so let's do a quick comparison of COVID-19 versus the flu and some other diseases. So the others include the common cold, seasonal allergies, and believe it or not, GERD and LPR, which are diseases that have to do with reflux, stomach acid reflux. So coughs are usually milder in common colds, and sneezing is rarer in COVID-19 and the flu. Runny nose is very common, the common cold, but less so in influenza and even less so in COVID-19. Maybe they're about the same, though that needs to be studied as well. But yeah, it's pretty rare in both of these diseases. And common cold almost never progresses to severe disease, so it's hoped that with time this coronavirus will as well. And now comparing allergies, sneezing is more common in allergies, sore throat and digestive symptoms are almost absent. GERD, LPR, you do get some of these symptoms. For example, sore throat might occur in LPR, but fatigue and aches really don't occur. And again, loss of taste and smell, it may be an important distinguishing characteristic of COVID-19 versus influenza and the common cold. Okay, so what can one do to prevent infection with SARS-CoV-2? Really, I don't want to have an exhaustive list, just very simply, wear your face masks. It's a respiratory disease, it's a respiratory sickness, so you have to be careful of droplets. Washing your hands isn't really so important unless you're touching it on your mouth or nose. This is a more rarer kind of mode of transmission, but of course it does occur. There is this thing called hygiene theater where people just keep spraying everything and they don't wear masks, and yeah, everything is fine because we're spraying everything. Or you have these hotels where you just go in and you get sprayed. Yeah, this is hygiene theater. This really isn't going to help. And of course physical distancing, so you're just not social distancing. I like the term physical distancing better. So you're separated by 2 meters, so less chance of catching some droplets. So do the symptoms differ between different age groups? Yeah, somewhat, because severity differs. Younger people have less severe disease. So shortness of breath is less common in younger individuals as compared to older individuals, and other such symptoms of severe disease. So this is a somewhat exhaustive list of the risk factors associated with severe illness. I'm not going to read them all. Some of them make obvious sense, like lung diseases, immunocompromised status, smoking. Obviously that's going to be bad when you have a disease that or an infection that really attacks your lungs. And something to note, for example, male sex, I think that's more commonly because males smoke more than women, but yeah, there might be something more to it with testosterone. Not clear as of yet. Race and ethnicity, this is a big problem in medicine. We really should be trying to fix this. It's unacceptable, quite simply. And yeah, for example, lymphocyte count, D-dimer level. D-dimer level is rather predictive. Yeah, so these are some risk factors. So what's the trajectory of the disease? Well, it can be divided into 3 phases. The viral phase, where you're showing signs and symptoms of the disease. And then the pulmonary phase, or clotting. This is where you need to watch out, where people are put on anti-clotting medication, because sometimes people have strokes and unfortunately die because of this. And the hyperinflammatory phase, this is the cytokine storm. So cytokines basically are released in a great amount. That's why they call it a storm. And this is very damaging to a lot of the body's tissues. It does take care of the virus, but when you're going into this overdrive, it also hurts normal tissue. So that's why even after the viral phase, after the virus is basically gone, sometimes you get this overdrive from the cytokine storm, and this can lead to bad consequences as well. And Dr. Griffin over from TWIV, This Week in Virology, he notes more divisions. I like his pre-symptomatic definition, because that's when you really are a carrier of the infection but don't have the disease yet. When you do progress to disease, sometimes you don't, sometimes you remain asymptomatic. In that case, you're labeled asymptomatic. And the tail phase, this is quite a nice way to view the disease, because there are people who are sick with COVID-19 for a very long time. Some people still have signs and symptoms for months. So that's something, they're called the long haulers. So that's something that really needs to be, there needs to be more attention paid to this. So it shouldn't be that dangerous for pregnant women, though of course there are bad consequences that could happen, which are dangerous to the fetus and to the mother, and sometimes to both. And there's a possibility of transmission to the fetus, and this has been proven. So this is a big problem as well. So yeah, pregnant women should definitely avoid SARS-CoV-2 for their health and their baby's health as well. So I should note that children do transmit the virus, even if they're asymptomatic, which is more common in children because they have less severe disease. So yeah, you need to watch out for that. Even though they might not have as severe a disease, there still are some children who do get adverse effects from the disease, and even then they might transmit it to grandpa and grandma, and this is going to be disastrous. So yeah, children should avoid infecting themselves with SARS-CoV-2. That's quite obvious. So thankfully, the treatments for SARS-CoV-2 have been really developing well. Remdesivir, the trial for Remdesivir was stopped because it was shown that it has a modest role in improving the condition of the patients who are taking it. We won't have conclusive evidence because it was stopped for ethical reasons, because you don't want the control group not to receive a medication that is helping just by a bit. Inflammation fighting medications, remember when we talked about the stages of the disease, so these are also very important, especially dexamethasone and anticoagulants. We also talked about that. Oxygenation, ventilation, pronation, these are done in more advanced cases. Pronation has been shown to be quite effective when you put someone on their stomach, laying on their stomach. And convalescent serum, it might be good, it might not, probably not, I would say, but studies are still ongoing. But it's not a miracle drug, or a miracle treatment, not even close. And hydroxychloroquine, it was being recommended, and for good reason, I thought, but no, unfortunately the studies did not really prove much. So animals do get infected, but they really show no signs. And transmittance really isn't an issue, because what's going to happen? You're going to put your pet dog at your neighbors and they're going to give it SARS-CoV-2, and then SARS-CoV-2 will spread to you. That might happen, but yeah, that's going to be rare. More likely the neighbor himself or herself will give SARS-CoV-2 to you, and not through that roundabout mode of transmission. But it might happen, so you should be careful. And it has been said that pet owners might suffer less from COVID-19 because pets are exposed to other coronaviruses, so there may be this cross immunity, but yeah, this hasn't really been proven. So this is some information about how long SARS-CoV-2 lingers on surfaces. You might want to pause the video. So yeah, it's between a few hours to a few days, depending on the surface type and depending on other factors such as temperature and humidity, of course. So the gold standard of SARS-CoV-2 testing is RT-PCR. But nowadays there have been faster antigen tests, which are becoming stronger and stronger and more accurate, and they're more helpful because the results are really rapid. In just like 2 minutes you could know whether or not you should go to school today. So these tests are very important, and I refer you to, of course, Michael Mina's episode on TWIV, which is linked in the references. Is reinfection with SARS-CoV-2 possible? That's a definite yes. But don't despair. Immunity is likely to be protective against the disease. So first time you might get the disease, but second time you might just get infected with no symptoms or very, very mild symptoms. So immunity to the infection will last for about 3 months, maybe more, but to the disease it might last for a long while, maybe even a lifetime. And because the severity of the disease, SARS-CoV-2, is between that of SARS-CoV-1, which is SARS, and the human coronaviruses, the common cold ones. So because the severity is in between, and because commonly it's said that the more severe a disease, the more immunity will last. So because of that, yeah, that's why we say it's about 3 months, maybe more so. Now we have to watch out for antibody dependent enhancement. This is when you have a low amount of antibodies which make the disease more severe. So when you have 0 antibodies and you get infected, your body will produce an immune response and you'll get cured. But if you have a low amount of antibodies from a previous infection and you get infected again, this very low amount of antibodies might produce a reaction kind of in your body, which makes the disease more severe, which prompts a stronger immune reaction that makes that produces the cytokine storm we're always afraid of. So yeah, we should watch out for that, and hopefully this won't occur with vaccination, which we'll talk about later. When you're asymptomatic, when you don't have any signs or symptoms and won't have any signs of symptoms, and when you're pre-symptomatic, when you currently don't have any signs or symptoms but will develop later on, both of these will definitely drive infection rates and spread the virus. Asymptomatic transmission does occur, and it's very frequent actually. So I have this quote: even if you feel fine, stay out of line. SARS-CoV-2 is a respiratory illness, so that's unlikely that blood transfusion can spread SARS-CoV-2. One study actually showed that someone with SARS-CoV-2 who was positive for it gave blood to someone else, and that someone else did not get infected with SARS-CoV-2. But who knows, it might happen. We know that pregnant mothers can give SARS-CoV-2 to their fetus, so yeah, one should always be careful. So are there different strains of SARS-CoV-2? This debate hasn't been settled. It's still raging very violently currently. I really don't know. Probably yes, I would say. Dr. Vincent Racaniello, Earth's virology professor, he really doesn't believe there are strains, and I agree with most of what he says, but newer evidence is kind of showing that there are. So really, I don't know. But just something that's important is that if you had a lighter illness, it doesn't mean it was a weaker strain or a lighter strain. That's really just nonsense, to be honest. Can you get SARS-CoV-2 from food? Well, if you're going to eat it, I'm almost sure you won't. But if you touch the packaging and that packaging has some droplets from an infected person, you might, but again, this is a very unlikely mode of transmission. So yeah, you should probably be relaxed when you're taking in food. Vaccination, our way out of this pandemic. So yeah, there are 4 vaccines currently in phase 3 trials. But I should note that many small-scale vaccines, because if these large-scale vaccines don't go as planned, we need to have backups and backups for the backups and backups for the backups. Vaccination will be our way out. Our other way out is herd immunity, which will take years and is not really feasible on the healthcare system. So yeah, vaccination is our quicker way out of this terrible pandemic. And vaccination will take a while for development, for people to get it, for there to be no adverse side effects, for ADE to not occur. But slowly the world's population will become vaccinated and we will finally lead on normal lives. We really need to prevent future pandemics, so we need to do the necessary field work. We need to map out viruses. We need to start working from now on antivirals for these viruses. We need to act fast. We need to think. Most important, we need to think about the future. That's the only way we can prevent future pandemics. By the way, there might be an influenza pandemic, so we should start working on that from now. So how will the pandemic end? Well, vaccination will be the primary way out, but it might not be infection preventing vaccination. We might simply get rid of COVID-19, but we still might get infected with SARS-CoV-2, but it won't lead to any symptoms or will lead to very mild symptoms, which is something we can accept because we already have the human coronaviruses, the 4, which lead to the common cold. But it will take a while, and unintended consequences related to ADE, that might be a problem, so we need to watch out for that. And unfortunately, the death toll has caused a tremendous loss of precious human and intellectual life. I think yeah, we've kind of regressed a bit with this loss of intellectual life. But hopefully we can use this pandemic to plan for the future. And now for the references, I will go through them a bit slowly for you if you want to pause the video. And of course we have the image credits. And yeah, with that, I hope you take care, guys, avoid infection. And yeah, we're waiting for the vaccine. Hopefully all goes well. Take care, guys.